If you're a senior, stroke prevention should be front and center in your daily life. The great news? Nearly 80% of strokes are preventable with small science-backed habits you can start today. Over the years, as I've worked with older adults and as I pay closer attention to my own routine, I've realized that every tiny choice you make, from breakfast to bedtime, has the power to protect your brain and preserve your independence. In this video, I'm laying out 9 daily habits that anyone over 60 can use to lower their stroke risk dramatically, based on research and real stories, not fads. I want to begin with what happens first thing in the morning because it sets the tone for your entire day. When I wake up, I make it a rule to start moving within the first few minutes. I used to lounge in bed, scrolling my phone, but I learned how dangerous that idle time can be. After 60, blood vessels lose elasticity and circulation slows when you lie around. Even sitting still for an extra 20 to 30 minutes can pool blood in your legs and force your heart to work harder, getting blood to the brain. That can trigger a surge in blood pressure, or if you have plaque buildup, it could send a clot towards your brain. Instead, now I do ankle rolls before I sit up, flex my toes, then move my shoulders and neck. When I finally stand, I do it gently and keep moving. Even just 2 minutes of these gentle stretches can prime your body and brain for a much safer morning. It doesn't take fancy equipment, just awareness and momentum. The next thing I do is drink a glass of water before coffee, before breakfast. Remember, aging blunts your thirst signals, so it's easy for seniors to be dehydrated without realizing it. In fact, over 60% of stroke patients arrive at the hospital mildly dehydrated. Blood thickens if you're dry, making clots more likely and raising blood pressure. I keep water on my bedside table and take regular sips throughout the day, aiming for 6 to 8 cups. If plain water is boring, I'll jazz it up with lemon or cucumber or switch to unsweetened herbal tea in the afternoon. But beware of excess sugar. It pulls fluid from your body and spikes blood sugar, both of which raise stroke risk. I focus on whole fruits for sweetness and never rely on sodas or juice. Now, breakfast. I used to skip it thinking intermittent fasting was healthy, but as I got older, I realized my blood sugar would drop too low and mess with my brain. Your brain runs on glucose and doesn't store much, especially after 60 when regulation gets trickier. If you take blood pressure or diabetes meds first thing, skipping breakfast can be even riskier, creating the perfect storm for dizziness, mental fog, or worse, a vascular event. These days, I reach for a small, protein-rich meal. Greek yogurt with walnuts and flaxseed, or scrambled eggs with veggies and a side of berries. The healthy fats and antioxidants in those foods lower inflammation and keep energy stable. If I'm pressed for time, overnight oats with chia seeds and banana always do the trick. Habit 4 is one that surprised me the most. Walking, especially after meals. I used to think that most exercise could wait until later in the day, but taking a brisk 10-minute walk after breakfast, lunch, or dinner smooths out blood sugar spikes, lowers inflammation, and improves circulation. If you can't leave the house, even walking up and down the hallway or doing chair marches changes your metabolism enough to make a difference. For seniors especially, walking right after a meal can reduce post-meal glucose spikes by up to 22%, lowering artery damage and keeping blood vessels more elastic. After dinner, when most people sit for hours watching TV, those sugars linger and quietly add stress to your system. A short walk helps you sleep better too, a bonus for brain health. Let's talk about diet in a broader sense. I focus on fruits, vegetables, whole grains, and lean proteins. Think colorful salads, salmon, beans, and low-fat dairy products. Avoiding high cholesterol foods like burgers, cheese, and ice cream is critical. Reducing salt intake is another must. I switched from regular table salt to herbs and spices to keep sodium under 1,500 milligrams a day, which made a huge impact on my blood pressure. I read labels for sodium content and steer clear of packaged snacks. By maintaining a plant-heavy diet and cooking most meals from scratch, I have more control over my health and how my body reacts to foods. Habit 6 is exercise, and I've learned consistency trumps intensity. Seniors can reap huge benefits with even 30 minutes a day of moderate movement, walking, swimming, gardening, or dance. Exercise lowers blood pressure, improves cholesterol balance, and keeps weight in check. I commit to at least 150 minutes a week, sometimes breaking it into shorter sessions throughout the day. When the weather's bad, I do home exercises, lift light weights, or follow online stretch routines. The key isn't perfection, it's making movement part of your daily rhythm. I want to emphasize how important it is to keep blood pressure and cholesterol under control. I check my blood pressure at home regularly, logging the numbers so I can share updates with my doctor. High blood pressure is the #1 risk factor for stroke, and unmanaged cholesterol is next in line. My healthcare provider helps me monitor and adjust medications if needed, but diet often does the heavy lifting. Foods rich in healthy fats, like olive oil, avocado, nuts, and fish, raise HDL, the good cholesterol, and lower LDL, bad cholesterol. If your doctor recommends statins, don't skip them. They're proven to prevent strokes for high-risk seniors. Quitting smoking is habit 8, and it's non-negotiable. If you smoke, even just a few, after meals, please make a plan to quit. Smoking accelerates blood vessel damage and clot formation, adding years to your brain's risk clock. I reached out for help, leaned on family and friends, and used support lines. There are so many tools now, and every day without a cigarette is a win for your heart and brain. Managing chronic conditions is another daily duty. If you have diabetes, pre-diabetes, or high blood pressure, work closely with your physician to stay ahead of complications that can lead to stroke. That means regular checkups, following medication plans, and staying up to date on lab tests. I keep my provider's numbers handy and never hesitate to call with questions. If your blood sugar is out of range, take action early. Small changes add up, and staying proactive can save your life. Weight management used to be intimidating for me, but even modest progress lowers stroke risk. As metabolism slows after 60, I had to tweak portion sizes and pay more attention to calorie needs. I started calculating my BMI and set realistic goals for gradual improvements. Some friends and I motivate each other through gentle competition or shared recipes, turning weight management into a positive part of aging. The goal isn't restriction, it's nourishing your body so it can protect your brain for years to come. Good sleep is the 9th habit, and I didn't realize its power until I hit a rough patch with insomnia. Poor sleep can raise blood pressure and disrupt hormones, directly increasing stroke risk. I now follow a set bedtime, avoid screens at least 30 minutes before sleep, and keep my bedroom cool and quiet. 7 to 8 hours of sleep nightly is ideal, and I talk to my doctor about any issues. Sometimes sleep apnea or restless leg syndrome goes undiagnosed, so it's important to ask for help. What brings all these habits together is the mindset that prevention is not a single action, but a way of life. I've seen friends who waited until crisis struck, but building these habits proactively gave me not only better physical health, but a sharper mind and more confidence. I remind myself every day, protecting your brain means investing in small choices again and again. Focusing on hydration, healthy breakfasts, movement, plant-heavy diets, manageable portion sizes, regular exercise, monitoring blood pressure and cholesterol, never smoking, and good sleep may sound simple, but they're the foundation for stroke prevention. I urge you to take pride in every choice. Every walk, every glass of water, every salad. Every night of good sleep is another step toward protecting your brain and living fully. One habit that's often overlooked but incredibly important is staying mentally active. Keeping your brain engaged is just as critical as keeping your body moving. People often associate strokes only with physical risks, but there's a strong connection between mental inactivity and vascular decline. When your brain doesn't stay challenged, especially as you get older, it loses plasticity, that ability to adapt and stay efficient. I make it a point every day to stretch my mental muscles, just like I do my legs. I read books, do Sudoku, learn simple phrases in a new language, or even try out new recipes. These aren't just hobbies. They're protective strategies that strengthen neural pathways, improve memory retention, and help the brain recover faster from any cardiovascular or neurological event. Don't underestimate how powerful it is to stay intellectually curious. Whether you're solving puzzles or learning how to edit photos from your grandkids, you're feeding your brain the input it thrives on. But mental fitness isn't just about isolation. It's more powerful when it's socially shared. That brings me to another essential habit that's had a huge impact on my overall well-being: regular social connection. Loneliness and social isolation are now considered serious health hazards for seniors, carrying risks as deadly as smoking or obesity. They increase blood pressure, raise stress hormones like cortisol, and worsen inflammation, all key stroke contributors. That's why I make it a personal mission to connect with someone at least once every day, whether it's a phone call, a walk with a neighbor, FaceTime with my kids, or chatting with someone during a morning errand. These connections help regulate my mood, make me more likely to laugh or move, and remind me I'm part of a bigger community. Social health is brain health, so if your social circle has shrunk over the years, don't wait. Reach out, say yes to invitations, or be the one to initiate. Sometimes a 10-minute chat does more for your blood pressure than medication ever could. A related but deeply personal practice I've added is stress management. Because after 60, unmanaged stress becomes more damaging to the heart and vascular system. Chronic stress raises inflammation, triggers hypertension, worsens sleep, and taxes the immune system, essentially putting your whole body on high alert, which increases stroke risks silently over time. I began using deep breathing exercises daily, just 5 to 10 minutes of focused breathing in the morning or before bed. Inhale deeply for 5 counts, hold for 5, and exhale slowly for 5. This calms the nervous system and lowers resting heart rate. I sometimes add light meditation or gratitude journaling, both of which help rewire stress responses. And I've learned to identify emotional triggers, whether it's obsessive news watching or overcommitting myself, and reduce them before they drive up anxiety. Managing stress proactively is like giving your heart and brain a reset button every day. Another habit I swear by, and this one took me longer to realize, is eye health and how it connects to stroke prevention. Vision changes are common with aging, but ignoring them can lead to more falls, missed doses of medication, or not recognizing early signs of stroke like blurred or double vision. I make sure to get my eyes checked every year, but more than that, I organize my daily space for safety and clarity, adequate lighting, removing trip hazards, and keeping important items clearly visible. Fall prevention matters enormously for seniors, not just because of injuries, but because falls can sometimes indicate small strokes or TIAs, transient ischemic attacks, have already occurred. Paying closer attention to how your eyes, balance, and mobility relate to each other can catch red flags early and let you get help before something more severe develops. Speaking of early detection, I've made stroke symptom awareness part of my everyday mindset. I started reviewing the FAST method monthly just to keep it fresh. Facial drooping, arm weakness, speech difficulties, and time to call emergency services. But I also learned the lesser-known symptoms, especially for women and seniors, like sudden fatigue, confusion, loss of coordination, or visual disturbances. By checking in with myself, I literally do a 30-second internal scan each day. I've trained myself to spot when something's off. Knowledge here is power. Recognizing the signs early can cut treatment delays and serious consequences. I encourage all my friends to print the FAST chart and stick it on the fridge. Acting quickly in a stroke situation is not overreacting. It's life-saving. Let's not forget how medication management plays a critical role in preventing strokes. If you're on medications for blood pressure, cholesterol, diabetes, or atrial fibrillation, take them exactly as prescribed. I use a weekly pill organizer and set reminders to avoid missed doses. It's easy to dismiss one missed pill, especially if you feel fine, but stroke risk compounds when routines slip. I've talked to countless older adults who were inconsistent with blood thinners or forgot their beta blockers and ended up in the ER. Simple systems like daily pill alarms or smart dispensers give you back control. During doctor visits, I always bring a complete list of meds so we can review interactions, adjust dosages, and keep everything streamlined. If cost is an issue for you, don't stay silent. Ask about generics or programs for seniors. Keeping your medications organized is not about being perfect. It's about being consistent enough to protect yourself every single day. Finally, something more spiritual, but equally essential: maintaining a sense of purpose. I've found that having a reason to get up every morning, a worthy goal, a garden to tend, a letter to write, really strengthens my resilience. It reminds me that this journey of prevention isn't just about avoiding a stroke. It's about crafting a life worth protecting. I talk to other seniors who volunteer, babysit grandkids, study new subjects, grow herbs, or mentor the next generation. These passions stimulate the brain, nurture joy, and powerfully support emotional well-being. When you see yourself as a vibrant contributor to your family, your neighborhood, or even just your local walking group, you're living with intention, and that intention, that momentum, buffers against stagnation, the kind that silently accelerates physical and mental decline. So, as I integrate these routines into my days, I don't view them as chores. I view them as lifelines. From mindful water drinking to movement after meals, from checking in with friends to managing my prescription schedule, each habit is a deliberate act of stroke prevention. And you know what? It all adds up. It's not about being perfect every single day. It's about being consistent most days and forgiving yourself on the off days, then picking right back up. You're not too old. You haven't missed your chance. Stroke prevention starts whenever you start choosing differently. If this message resonates, please share it with the seniors in your life or anyone seeking to age well. Prevention is in your hands and your habits. Let's keep our brains healthy together, one day at a time. Thanks for watching. Like, share, and subscribe if you like this video. Stay safe, stay curious, and above all, stay human.